Our next speaker is Dr. Prateek Nishant to present on a prospective comparative study to evaluate the accuracy of vectorally analyzed iris photographs for objective assessment of ocular torsion in patients operated for cyclovertical strabismus. You should share your screen, and I would want Dr. Subhash and Dr. Vibhuti to comment. Yes, you can start, Dr. Prateek. You unmute yourself.
For the diagnosis and measurement of ocular torsion, subjective and objective methods have been described. The latter include measurement of disc fovea angle on fundus photographs, infrared photography of distinctive iris features, and recently the use of consumer-grade DSLR camera equipment and personal computer software for capturing and analyzing pixel coordinates of iris landmarks. The gold standard of disc fovea angle measurement on fundus photography involves increased costs, time delay, and inconvenience in uncooperative children and hazy media. Head tilt correction has been done by several methods and image analysis by several software. Iris photography has been mostly described using video-based or monocular methods. There are limited studies in describing binocular iris photography for assessment of change in ocular torsion, and none of them in Indian eyes. Hence, the need for such a study was felt to develop a simple low-cost technique for the purpose. The objectives were to measure change in ocular torsion by the two techniques, finding the accuracy of this measurement using the novel technique, and to develop a method of binocular iris photography using a DSLR camera for Indian eyes. This was a prospective comparative study with an experimental component conducted in 30 eyes of 15 patients over a year, and it was approved by the ethics committee. It included subjects over 8 years of age with diagnosed cyclovertical strabismus and excluded those with ocular pathologies hampering imaging, unwilling, and uncooperative patients. The iris and fundus photographs were taken pre and post-operatively, and difference in torsion compared and determined. The iris photographs were taken in forced primary position using DSLR camera, minimizing head tilt with the double-axis spirit level. The camera settings, as shown in the table, were found by experimentation. Central fundus photographs were taken using camera side marks to reduce head tilt. The Corel Draw X3 software was used to calculate disc fovea angle, read pixel coordinates and iris landmarks, and slope of lines joining the pupillary centers to these landmarks. Iris torsion angles were calculated using Microsoft Excel spreadsheet involving 4 iris landmarks. The appropriate statistical tests were applied, and these are the demographic details of a sample. Various types of cyclovertical strabismus were operated upon. Objective X cyclotropia was seen in 10 eyes and in cyclotropia in 5 eyes. These are the pre and post-operative photographs of a representative case. The absolute difference in disc fovea angle and iris torsion angle were calculated, and Wilcoxon sign rank test showed that these were not statistically significant. The difference between the two methods was also calculated. These parameters were analyzed with measures of central tendency and dispersion. Mean difference between the two methods was minus 0.15 degrees with a standard deviation of 0.9. Further analysis confirmed normal distribution of the difference between the two methods. The Spearman's correlation coefficient was 0.85, implying strong correlation. The bland Altman analysis showed that most observations were between 95 limits of agreement. The two one-sided tests based on Welch-T test was done and showed equivalence of the two techniques with the gold standard. The residual head tilt remained less than 1 degree. Binocular photography represents a more physiological state of cyclofusion. However, the difficulty in vectorally analyzing the iris pattern has been recognized by previous researchers. The present study corroborates well with the initial report by Felius et al., and it has been described that the settings used was with an accuracy of plus minus 2 degrees of the gold standard. This slight discrepancy is because the assumed center of the rotation is coincident with the pupillary center, but this is true when the camera's optical axis and the line of sight coincide. The large gaze errors are unavoidable in strabismic patient even with advanced methods of training. This is the first study of this kind in India. Thank you.
Thank you very much. Dr. Subhash?
Thank you, Prashant, for a new innovative technique, and I would like to congratulate you for describing this. the limitations in large angle strabismus are well known with this technique, and it is an excellent study.
Dr. Vibhuti?
Prateek, just one point to be asked. Congratulations on this presentation. What were the lacunae when we are using this camera, DSLR camera, for capturing the photograph? What are the points which you want to highlight where lacunae can develop?
So one of the most important lacunae which can develop and which can skew the results is the effect of the head tilt, which is very much significant and has been variously studied, and various methods have been applied for the correction of this problem. Actually, we used a double axis spirit level tape to the forehead of the subject. So the two levels, the spirit levels have to be observed that the bubble of the spirit level has to be between the two lines, which ensures that the head of the subject is level with the ground and not tilted. And also you have to ensure that the Frankfurt lines, that is the line between the ear and the lateral canthus, that has to be parallel to the floor. So basically, first problem is that of the head tilt. The other is that the settings have to be very specific so that they are universally applied to the Indian eyes, because the irides are very dark. Any change in these settings is unlikely to produce the same result that has been found in the experimentation in our studies. And
Prateek, Chitra, can I ask a question?
Yeah, very brief. I think.
Yeah, Prateek, how is this superior to the standard gold standard of fundus photography? And is the DSLR camera handheld or tripod held?
Sir, the DSLR camera is tripod mounted, and it is slightly superior to the fundus photography because of the increased costs and need for mydriasis and the time delay which is caused. Also, in uncooperative patients, it is difficult to capture accurate fundus photographs, which are fovea centric and which can be analyzed by the computer software.
Thank you very much. You did very well.